Hey folks, welcome to the webinar for today. I'm just going to give it a quick minute to ensure everybody is able to join. While we're waiting for everybody to join, just to let everybody know, we are recording today this presentation. If you want a copy, just reach out to us and we can share a copy of the recording. All right, it looks like things are slowing down a little bit, so we'll just get started with some of the logistics. Thanks everybody for joining our joint webinar today with Idaho Supports Medicaid and the Idaho Center for Fiscal Policy. Today, we are going to um, Today, we are going to talk about all the recent healthcare policy changes that have happened in the past year. It's maybe a repeat for some of you, but we're just going to capture all of those upcoming Medicaid changes and what they mean in the coming year. And then we're also going to have Cole, who I'll let introduce himself here in a second, talk about recent food assistance policy changes and changes to the SNAP program, and then how to take action and get involved moving forward. My name is Hillary Matlock. I'm Policy Director at Idaho Voices for Children, and I am joined today with Cole. Cole, do you want to say hi?
Hi, everyone. My name is Cole Lancaster, and I'm a policy coordinator with the Idaho Center for Fiscal Policy. And my policy areas include food security and affordable housing.
Perfect. Thanks so much, Cole. If there are any media members on this call, if you would like to speak to us about any of these things, please reach out to us after the webinar. We're happy to, if you would like a quote or would like to understand some of these provisions more, please just reach out to us directly and we'd be happy to talk to you a little bit more or provide any quotes if you're looking to do any sort of media coverage on what we're talking about today. So to start out, I just want to acknowledge that Idaho Supports Medicaid. We are a statewide network that is working on access to healthcare through the Medicaid program. For those of you who are not on our monthly meetings, maybe our monthly webinars, maybe you came through from the Idaho Center for Fiscal Policy, welcome. A little bit of background, Idaho Supports Medicaid. We are coordinated by a group of different stakeholders around the state, and our goal is to ensure that Idahoans get the care they need, that Medicaid is kept strong, and work to promote healthy communities. And for those who don't know much about the Idaho Center for Fiscal Policy, I'll let Cole introduce the
Yeah,
center.
sounds great. Thank you, Hillary. For the folks that aren't familiar with the center, the Idaho Center for Fiscal Policy is a private, not-for-profit, and nonpartisan organization committed to offering Idahoans high-quality research and analysis to help a state make informed policy decisions and contribute to a prosperous Idaho for years to come. We believe in making the right investments today so our state will thrive tomorrow.
Great. Thanks, Cole. All right, let's go ahead and jump in. We have a lot of things to cover today. I'm realizing I forgot some logistics. So everybody is muted. If you have a question, please feel free to put it into the chat, or you can use the Q&A feature. I believe I have it enabled. So use either option. If one isn't working, try the other one. Also, just for those who maybe have recently joined, we are recording this webinar. If you would like a copy, please email me or Cole, and we'll send you a recording afterwards. So we're only sharing it with those who directly ask. So just email us, and we'll share our emails again at the end so that you know how to contact us. Okay, so let's jump into this. Let's talk a little bit about all of the changes that have happened in healthcare, and particularly the Medicaid program. It's going to be pretty focused on the Medicaid program today. So one of the things that I do want to do, just given that this is co-hosted with the Idaho Center for Fiscal Policy, some of you may not know a lot about the Medicaid program. So I'm just going to do a really quick overview and recap about the Medicaid program. And so that you know what we're talking about today when we talk about policy changes and changes to the program. So, just from a high level, Medicaid is health insurance assistance to those that qualify for the program. It provides health insurance benefits. Different types of services are preventative screenings, inpatient, outpatient hospital services, prescriptions, cancer treatment. It also provides pregnancy coverage for low-income mothers and families, as well as very specific services to people like who have disabilities and seniors who need long-term care and who are low income. And then also Medicaid provides health insurance to the low-income adults, what is known as the Medicaid expansion population. An interesting fact about Medicaid in Idaho, it covers about 350,000 individuals in the state, and about half of the population are kids. 1 in 3 Idahoans on Medicaid expansion have a serious mental illness diagnosis. It is also the largest payer of behavioral health services in the state. Medicaid covers all foster youth in the state of Idaho, as well as many children who receive out-of-state residential treatment for mental health and behavioral health issues. When you look at overall who Medicaid covers, there's really a couple of different buckets. When you look at this, there's the traditional Medicaid program. These are covered, this covers children, people who have a disability, if you are pregnant or within 12 months of having a baby, and then seniors who are low income or have disabilities. So that's what we call our traditional Medicaid population. Then we have our Medicaid expansion program. This is a newer program that started in 2020 that was an option states got to opt into. We opted into it because voters passed this as a ballot initiative in 2018. So what that looks like is you have to be low income to qualify for the program. So just to give you an example, parents who make about, so let's say you have a family of 4, for the parents to qualify for Medicaid, you can't make more than about $3,795 per month gross income. If you're for a single adult, it's $1,836 a month in income. Something that is interesting, I always like to say, Medicaid expansion income eligibility is very specific to adults, and eligibility looks very different across the other population. So children actually are covered at a higher income eligibility. So parents can make higher than this $3,700 a month. So even though so parent and children eligibility is different. Also, if you have a disability or you're a senior, those populations do have different eligibility guidelines. And then I always like to point out that next is what are called marketplace subsidies. Many of you may have heard of it as Your Health Idaho, the state health insurance exchange. And this provides health insurance and to some folks, health insurance tax credits to help cover the cost of monthly premiums. And this is for folks and families whose income is over that Medicaid expansion limit. So if you're some parents in that family of 4 and you're making over $3,700 a month, then you would qualify for a tax credit to help purchase health insurance on Your Health Idaho. Okay, so let's talk a bit about all of the Medicaid policy changes, healthcare changes that are happening between this year all the way through 2030. And I'm just going to go from a pretty high level on these. So there have been and I'll just say a lot of these are cuts. We've had a lot of cuts to healthcare happen and come down the pipeline through policy changes that have been enacted both at the state and federal level. We have seen a 4% provider rate cut to the Medicaid program. So payments, when you look at the Medicaid budgets that are passed in the state of Idaho, most 95% goes to pay for healthcare services. So what goes to pay to providers for healthcare services was reduced as a result of this from Governor Little action as well as the legislature action. And that is ongoing moving forward. There also had been a few service reductions and cuts to the Medicaid program. So Additionally, starting next year, we're going to see more frequent eligibility checks for Medicaid expansion adults. We also are going to start seeing some cost sharing, also known as copays, applied to the Medicaid program for different types of services. And this was going to be applied across the board to all populations to what is federally allowed. There's also community engagement, also known as work reporting requirements that start in January of 2027. There's been changes to retroactive coverage in the Medicaid program. So when you apply to Medicaid, if you had any medical expenses in the past month, you may be able to get those covered if you have qualified during that time within the last month. It used to be 90 days. For Medicaid expansion, it's been shortened to 1 month. For all other populations, so your traditional populations, it's gone from 90 days down to 60 days, and that also starts in January of next year. And then Medicaid has largely been in a payment model called fee for service. And that is going to be shifted over to comprehensive managed care, which basically means that they're going to take the Medicaid population and Medicaid payments and hand over the coordination to basically a private insurance company to manage that program as opposed to the state managing that program. And that is set to go live in 2030. And I'm not going to go too much into detail on that today. Let's see here. And then one of the things I also like to highlight, back at the end of last year, we also saw an end to, saw state health insurance tax credits get reduced starting in January of this year. These had been enhanced during the COVID-19 pandemic to help offset the cost of rising health insurance costs and to make sure folks could pay for their health insurance and keep their coverage. Those were time limited. They expired at the end of last year. And so this is basically what you're seeing. Most families are seeing an increase in how much they're having to pay out of pocket for a health insurance program that they would purchase on Your Health Idaho or the state health insurance exchange. So we have basically, when you look at all of these big policy changes that are largely impacting the Medicaid program, but it's also impacting a lot of more middle income families in the state of Idaho, we are anticipating a pretty significant increase in the number of uninsured Idahoans over the next several years. We're anticipating all the changes that are happening to Medicaid will likely see a reduction in Medicaid populations by about 40,000 people. And then also the state health insurance exchange, because those tax credits were reduced, we are seeing a lot of people disenroll from the program because they just no longer can afford health insurance. So we're anticipating another increase in about 35,000 over the next couple of years. Okay. So let's talk a bit about the big Medicaid changes that are coming up that are going to impact people and the populations that maybe a lot of you serve or maybe work with, or maybe even you have Medicaid yourself. We're going to talk through all of these from a high level of what you need to know and to help be informed as those changes start unfolding over the next year. So here's what's changing for Medicaid adults. Medicaid expansion adults are going to be subject to new reporting rules to keep their coverage starting in January of 2027. Adults between the age, so this is adults between 19 and 64, and they are not eligible for Medicare. There's a requirement that you must be able to report work, school, volunteer activities, or meet an exemption, and you will have to renew your coverage every 6 months. So in order to meet the requirements, there's two pathways here. Let's look at if you are applying for Medicaid on or after January 1st of 2027, you have to show compliance and exemption for the previous 3 months. So if you are not currently on Medicaid, or you have somebody who is not currently on Medicaid and they apply after January 1st, they have to show that compliance for the previous 3 months. If you are already enrolled in Medicaid, when the new requirements begin January 1st of 2027, your requirements will begin on your first renewal in 2027. So there's this, the Center for Medicaid and Medicare Services put out what's called an interim final rule. This is a document that tells state agencies like the Department of Health and Welfare how to implement all of the changes that are happening to the Medicaid program. So all of these changes that are happening to the Medicaid program, the work requirements, more frequent redeterminations, in particular retroactive coverage, they are mandated for every state that has a Medicaid expansion population because it was federally required as a result of HR 1, the One Big Beautiful Bill Act that passed July of last year. And so the federal government, also Center for Medicaid and Medicare Services, is because they are the federal regulators, it is up to them to tell states how to implement HR 1's new rules for Medicaid expansion. So June 1st, which was a highly anticipated date for states to receive this interim final rule because it was basically a 400-page document on how to implement these new rules. And what this IFR covered is who is going to be subject to the work requirements. What is the scope of exemptions and exclusions? What does compliance and documentation look like for applicants and renewals? What are noticing requirements to individuals? And what are the reporting requirements that the state has to make to the federal government? I'm going to keep this pretty high level to help try to understand what the big things, the most important things to take away. Like I said, it's a 400-page document, and we could probably be here a very long time going through intricacies that are more likely just going to bore you. So I'm just going to start by explaining the different qualifying activities. So for Medicaid expansion adults, here is how you prove that you meet the exam. You are proving that you are meeting the new rules. And this is what the different activities that are called qualifying activities are to help you show what that you are meeting these requirements. So let's look at work. So the rule clarifies that work can be both in-kind and unpaid work, as well as traditional employment. So let's say you have a job, or let's say you're self-employed, as long as you're able to provide like documentation that shows that you are and I'll be honest, I'm not exactly sure what type of documentation they are going to look for in-kind and unpaid work. However, whatever your employment documentation you have, whether that's a pay stub, your tax documents, or anything of that sort, um, that's how they clarify the activity for work. Community services. So within the work requirements, you have to essentially meet 80 hours of qualifying activities a month to keep your coverage. So, and it can be any combination of these things that you're seeing on the screen. So it can be work, community service, going to school, participating in a work program. Any of those combined just need to equal about 80 hours a month. And so let's say you community service is your way to meet that requirement. It is defined as unpaid work under a structured program that has to benefit the community, and it has to be under supervision of a public agency, cannot serve or a nonprofit, cannot serve a partisan purpose. However, the agency or nonprofit has to be willing to provide oversight and maintain a process to track the activity that you volunteered for, the date, and who is a point of contact for the department to verify. So that is a requirement under the community services. A work program. So let's say that you are unemployed and you are in the process of looking for a job. As long as you're involved in any sort of supervised job search or job search training, if the activity is you can also count unemployment insurance activities. So if you're on unemployment insurance and you're already doing the things for that program, it counts. you can be enrolled at least half-time educational program. That's a qualifying activity. So the rule clarified that if you're enrolled in high school or any state-approved high school equivalency, or let's say you're enrolled in college, community college, in any sort of institution, they will defer to the college or institution on whether or not you're enrolled full-time, half-time, or less than half-time. If it's less than half-time, hours still will count, and they have a certain methodology of how they calculate that based on how many credits you're taking. So if you're going to Boise State University and Boise State says, oh, yep, you're enrolled at least part-time, as long as you show that to the state, that is your qualifying activity. Monthly income. So this is also something that was a really important clarification. So this is household-based income. As long as you are making the federal minimum wage, which is also Idaho's minimum wage, of at least $580 a month. So that is federal minimum wage, 20 hours a week, 80 hours a month. If you have household income that is at least the minimum, it qualifies you for the work requirement. You also are able to, if you make less than that, they count it as some hours towards your total 80 hours. This is really important because let's say that you are a stay-at-home mom or a parent and your child is a teenager. Let's say that you have a spouse who is working. You just have to show that spouse's income, that's household income, as long as it's 580 at least a month, qualifies you for the work requirement. And then seasonal workers. So this also clarified that states that already have reasonably predictable income methodologies, they use that same methodology for the work requirement. So this is a really wonky way to basically say, hey, states already have a method of how they calculate annual income for seasonal workers. They just need to use what their existing policy is. So in Idaho, it's 12 months. So the state just has to look at income over the past 12 months and just say, okay, for the last 12 months, your average income for the last 12 months was $580 per month. So you are good to go, even though maybe you only worked 3 months out of the last year. As long as it averaged to be 580 a month, then you're good to go. Okay, they have a bunch of exclusions. And so when you look at the excluded individuals, it's former foster youth, American Indian, or if you are eligible for Indian Health Services, inmates in public institutions, veterans with a total disability rating. If you are in a household that receives SNAP or TANF and you're already meeting those work requirements, it qualifies you for the Medicaid work requirements. If you are pregnant or have had a baby in the last 12 months, if you're participating in a drug or alcohol treatment program, and if you are a parent or a caregiver of a dependent child under 14, or you're a caregiver of somebody with special needs or who has disabilities. Then also if you are medically frail or have special medical needs. And why this is in red is because this new interim final rule got very specific on what this means. So when you look at the medical frailty definition, it very specifically says you need to meet one of the following criteria, and you must also show that the condition impairs your ability to meet the work requirement. So if you are blind or meeting an SSI or SSDI disability criteria, you have substance use disorder unless you are 5+ years in a stable recovery. You have a disabling mental disorder or a disability that significantly impairs more than one activity of daily living or a serious or complex medical condition. So you have to fit into one of these 5 categories. And then you also have to show that not only do I have this condition, but I also cannot meet the requirements to keep my coverage. And states cannot add additional categories. So this is a little bit more narrow than what was included in HR 1 that has had a lot of folks really frustrated and concerned about coverage losses that are likely to come because this became more narrow. So one of the other clarifications in the IFR was around verification. So, how do states verify the individual's paperwork? How do they verify if they still qualify for Medicaid under these new rules? So, states have to use reliable information available to them. So it's known as ex parte, which is a super wonky term to basically just say, hey, look at all your data systems you have available to you and look and see if you can identify that they are meeting these requirements. So, oh, we have income data, check. They're meeting the requirement. Oh, they have a kiddo who's under 14, check. Oh, they have a child who is they are caring for or a family member with disabilities, check. So they're able to go in and just automatically verify that you still meet those requirements. Nothing that you have to do going forward. If there is not enough data in their system to verify that you're meeting the requirements, that is when a renewal document form will go out to an individual to say, hey, we need more information to know whether or not you can still qualify for the Medicaid program. One of the things that is a little different in 27 versus 2028 is during the first year of implementation, states basically can accept what's called self-attestation. So if let's say you don't have documentation to prove that you are falling into one of the exempt categories, if you just say, hey, I am in this exempt category, they'll take your word for it. They won't ask you to submit further documentation. The feds are allowing that flexibility in 2027 to allow people time to get coverage and establish care with doctors and be able to get the documentation they need to actually be able to show documentation that they should qualify further for an exemption. So that's why in 2027 it's much more lenient. But starting in January of 2028, documentation will be required if no other reliable information is available that they already have in their system. But their hope is, let's say you qualify for a medical frailty condition, and they have data claim systems. They're able to go in and look at that. So it is a little bit different, 2027 versus 2028. Let's see here. So From from a high level, what we're anticipating, we've always anticipated an increase in the number of uninsured people going to happen from the work requirements alone. There is concern that because of the medical frailty, more stringent and also more stringent self-attestation, that their coverage losses might actually be a little bit higher than they were anticipating. Also, it is by far the harshest work requirement to date. It includes the largest age range of 19 to 64. It's also you have to comply before you are even enrolled in the program. And another kicker of this is if you lose Medicaid because you don't meet the requirements, you are still not, it actually prevents you and bars you from accessing any state health insurance exchange tax credits to purchase health insurance. So it kind of leaves it leaves you without not a lot of options other than just going uninsured. So here's what I think everybody can expect moving forward. So the Department of Health and Welfare is going to start notifying the first group of individuals who are up for renewal in July of 2026. They are going to be sending out a letter if you are in the Medicaid expansion population to everybody. One, telling the individual, hey, you are in Medicaid expansion and the rules are changing. Here's what the new rules are going to be and when they're going to start being implemented. One of the things that we are telling folks, make sure your addresses and contact information is up to date. Create an online account if you don't already have one. Watch your mail for these notices. Additionally, there are going to be some opportunities put on by the department in July. Some informational sessions are going to be happening, some virtual town halls. And when those get posted of those dates, we'll share that out with the networks so they have the opportunity to join those and learn more about what's going on. There will be a resource page through the Department of Health and Welfare explaining the new rules. There's some flyers, some brochures. There's going to be opportunities for folks to get more information about when implementation starts and what that actually looks like. Folks are going to be getting text messages. One of the things I will say, the state is working to automate as much as they can so that they're really working on only reaching out to folks that they truly don't have documentation on. And so um, the so that's largely a lot of the bulk of what's happening within the Medicaid expansion program. I do know I've noticed a couple of questions that have come through here, so I'll just maybe take a second to answer a couple of questions here. So let's see here. There was a question. Oh, my computer's being slow. Oh, oh, maybe I missed it. So I think there was a question about self-employment. That is, I had mentioned it earlier, how if you are, even if you're self-employed, you just submit documentation of your income. If you are doing, let's say you do a lot of cash work, how that gets documented is unclear at the moment, and so that might have to be worked out in the coming months.
There was a question about having dependents in the household under the age of 14 being exempt from work requirements.
Yes.
What's your Medicaid answer for that?
If if you have dependents living in the home under the age of 14, you're automatically exempt. As long as the department has information that you have dependent children or dependents living in the home under the age of 14, you're automatically exempt. But I think that those are all the questions so far. Okay, I'm going to hand this over to Cole to go over some of the SNAP changes. And then if other folks have more questions, please feel free to put them in the chat or questions, and happy to answer those as we go. Oops, sorry, Cole.
Sweet. Thank you, Hillary. Welcome everyone. I'm going to talk a little bit broadly about what the SNAP program is and a little bit about its history, and then we'll jump on into changes that have happened at the federal and state level. So what is SNAP? SNAP stands for the Supplemental Nutrition Assistance Program. It is the country's longest anti-hunger program. It was incepted in the 1930s, later changed from food stamps to being called the Supplemental Nutrition Assistance Program, also known as SNAP, in the 60s. And to date, it is one of the most effective ways at combating food insecurity within the United States. So, how does it work? When someone applies and gets accepted into the program, they are granted access to receiving something called an electronic benefit card to access monthly benefits used on certain products that are put together by the USDA in order to purchase nutritious and healthy food at grocery stores, convenience stores, and gas station at SNAP retailers. And it is also a great way for people to support local economies by increasing the money that's spent for food at local retailers. And that's a little bit about the program broadly. Can you click to the next slide, please? So a little bit about the statistics of SNAP. Roughly 130,000 people in Idaho are in the program, and who's in it? This program serves people who are low to moderate income in the United States, but specifically in Idaho, about 50% of households have children. 50% of the households of SNAP participants have a person with disability. One in three SNAP households have an older adult, and about 6,000 people are veterans participating in the program. SNAP can be used at roughly 1,100 retailers across the state. This includes grocery stores, convenience stores, and gas stations. Next slide, please. Thank you. So many things have changed programmatically, starting at the federal level under the One Big Beautiful Bill Act that was implemented and passed into law last July. There were two main components that changed how the program lets people be uh, I guess, stay eligible for the program and also how much the states will have to pay for the program. One of the big things was expanded general work requirements. Technically, that took effect on November 1st of last year, but because of guidance being released by the USDA, a lot of states have been implementing expanded work requirements at different times. Idaho has still not yet implemented theirs. We have word that they should be implemented by the end of August-ish. That is still a tentative timeline. Um, and then regarding the amount of the cost of the program that states will have to pay. So essentially, the food benefit cost, so the amount of money that people get on their EBT cards, was historically 100% paid for by the federal government. But under the One Big Beautiful Bill Act, states are now going to have to start paying for a portion of the program depending on how many mistakes that the state makes. I'm going to try and keep this pretty broad. I'm not going to dive into the intricacies of how the cost share model works, but essentially, states are going to have to start paying for a portion of the program in fiscal year 2028, which starts on October 1st of 2027. So depending on how many errors the state produces within the program, depends on how much they're going to be on the hook for paying for the food benefit cost of the program. And then diving into some state changes that have happened in the legislative session in 2025, there were some waivers that were passed that are called food restriction waivers. Essentially, it means it redefined what could be purchased using the SNAP benefits. Previously, a few things that were already exempt that people weren't allowed to use benefits on included alcohol and food that had already been prepared. So, going to the deli and buying like a hot rotisserie chicken wasn't allowed. So, under these new purchase restrictions, they added what benefits could and couldn't be used on. And this took effect this year on February 15th. And those include redefinitions of what candy and soda are. So essentially, the state changed what benefits could cover, and this now excludes the state's definition of candy and soda. And under House Bill 730 in this year's legislative session, so legislative session 2026, um, there are now going to be more eligibility checks. So historically, depending on the household, households could go anywhere between 12 and 24 months without recertifying their household income to recertify their eligibility for the program. So starting on July 1st in about a week, households are going to have to start doing more frequent eligibility checks, which is now going to be every 6 months instead of traditionally every 12 months. Can you please click to the next slide? Thank you. So here's a map of the 50 states, and what this is referencing is this map is tracking changes in enrollment in the SNAP program starting in February 2025 last year. As you can see, in February 2025, specifically in Idaho, there were 134,000-ish participants in the SNAP program. And what the data is showing as of February 2026 of this year, there are now 124,000 enrollees in the program. We've seen about an 8% decrease in participation within the program. And while we can't pinpoint exactly what has caused specifically what has caused the decline in the participation in the SNAP program. We are noticing that under the House Bill 730 and under the One Big Beautiful Bill Act, it has put more barriers in place for people to receive and maintain their benefits. So that is a likely cause of seeing a drastic drop in the participation rate, and it's a trend we're seeing across the entire United States. Um, so that is very concerning. Can you please click to the next slide? Thank you. So what is this? What does this mean? Under the One Big Beautiful Bill Act work requirements, specifically for able-bodied adults without disabilities, it now includes two new groups of people who are going to have to participate in them in work requirements in order to maintain their benefits. This population was expanded to adults aged 55 to 64, and also households with children that are 14 years or older. Previously, if you had a dependent in the household that was aged 18 or younger, you would be exempt from the work requirements. And if you were between the ages of 55 and 64, you were exempt from the general work requirements. This bill also removed work requirement exemptions for people who were previously experiencing homelessness, veterans, youth aging out of the foster care system, and also refugees. Under House Bill 730, the more frequent eligibility checks will now be required every 6 months. And what this essentially means is household members will have to meet with the Department of Health and Welfare to verify their monthly income to make sure that they're staying within the program's regulations to maintain their benefits. And then also with the purchase restrictions, these purchase restrictions redefined what benefits could be used on. So the legislature went in and changed these provisions, meaning people are no longer able to purchase candy and soda, and medical exemptions are not granted. I'm going to dive into what those definitions look like in another slide. Next slide, please. So in order to be eligible for the SNAP program, you have to be a citizen or legal immigrant. You must be an Idaho resident in order to get Idaho SNAP benefits. You cannot exceed the income limits for household size. And then you also have to maintain general work requirements, which are participating in some sort of workforce development training, community service, or etc., with it equating to 80 hours a month, roughly 20 hours a week. So who's already exempt from this? People who are exempt from this, generally speaking, are people participating in alcohol or drug treatment, people who are pregnant, American Indians or Alaska Natives, primary caregivers of a child under 14, and people who are medically certified as physically or mentally unfit for employment. Next slide, please. So what does the definition of candy and soda look like? Per the Idaho Department of Health and Welfare website, candy is defined as a preparation of sugar, honey, or other natural or artificial sweeteners combined with chocolate, fruits, nuts, or other ingredients or flavors in the form of confections, bars, or pieces. Candy shall not include any preparation containing flour and shall require no refrigeration. So, what does that mean? I'm confused, you're confused. Essentially, this means that people are no longer going to be able to purchase, generally speaking, what the general public sees as candy on store shelves. But some of the caveats to this include the food restriction waiver for candy says granola bars without flour could be deemed as candy. So essentially, there are a lot of discrepancies within the language of this bill, meaning that per this definition, technically a Twix bar, because it has flour, uh, although seen generally speaking as a candy bar, could be purchased using benefits still. And then also for soda, soda is defined as any non-alcoholic beverage that contains natural or artificial sweeteners. Soda does not include beverages that contain milk or milk substitutes, are more than 50% fruit or vegetable juice by volume, and require preparation before drinking, such as powders or concentrates. So, under the soda definition, technically someone couldn't buy a pre-mixed Gatorade, but they would still be able to buy electrolyte powder. And then also, say your canned Starbucks drinks, if they have milk in them, they could still technically be purchased under the new soda regulations. But where this can be detrimental is there have been some issues with this, meaning people, or there was a case that someone who had a narcolepsy diagnosis would use energy drinks to stay awake. This new waiver now bars them from being able to purchase energy drinks in order to help with their medical diagnosis. And because medical exemptions are not given, it makes it harder for people to purchase food or candy that would help maintain a lifestyle that is compared to someone who is just trying to survive and work and do all the things. So another instance is, say, someone who's diabetic needs to buy candy in order to maintain blood sugar levels. This now puts another barrier in place of them being able to access um, food, candy, or soda per their definition under these new guidelines. But there is appetite in the legislature to try and make these definitions a little more tangible for retailers to follow. So, in this last legislative session, there were two bills that were introduced to redefine candy and soda to make it a little easier to follow the law. But they both died in committee, unfortunately. So, we'll see if there is appetite this next legislative session to try and make this a little more mainstream so that people receiving benefits and also the SNAP retailers accepting benefits makes it easier for them to follow. Next slide, please. So that is the beef of my presentation. But I just also wanted to throw this resource out there. So our friends over at the Hunger Free Idaho have a SNAP screening tool. You can scan this QR code using your device or text food to 74544 to complete a SNAP eligibility screener to see if you are eligible for the program. It is a great resource, so please don't hesitate to share it out. This will be included in any follow-up materials that we do send y'all. Um, so I'll leave it up for an extra second just in case you need it. Take a picture of it, do whatever you need. All right, next slide, please. So a few things to keep a lookout. The Idaho Department of Health and Welfare, circling back, um, will start to notify SNAP beneficiaries if they are subject to work requirements soon. The timeline is currently unknown, but we are expecting the end of summer. Starting in roughly a week on July 1st, House Bill 730 is now going to require more eligibility checks, and that will be going into effect. And also, food restrictions are in effect, but redefinition bills may pop up in the next legislative session. And some news actually came out today that a judge in Washington ruled that food restriction waivers should have been approved differently. So we'll be seeing some new guidance from the USDA, depending on what that ruling looks like on how this could impact the implementation of food waivers that are already enacted in about 22 states. Next slide, please. Some action opportunities.
All right. Thank you,
Yeah,
Cole.
of course. Thank you, guys. Are there any questions in the chat that we saw?
Not right now.
Okay. Anyways,
So I'll just go through a couple of things real quick. If you have questions, feel free to put them in the chat. So we always, just given that this is a co-hosted webinar, we just want to share the resources that we have moving forward so that you all are aware. So we really are here to help folks navigate policy changes that are impacting programs that are important to Idahoans in the state. And so we always have action opportunities off and on throughout the year. While we work heavily within different times of year, like the legislative session, we're always holding webinars, advocacy trainings. We help you stay up to date on these policy changes, as well as we put out reports. We are active across all social media platforms, Facebook, Instagram. I believe even a little bit on TikTok. And we also like to help connect folks to lawmakers so that you can share how policies are impacting you. We also really like to talk to individuals who are in these programs to understand how different procedures within the programs, as well as how the programs themselves are benefiting folks, where opportunities for improvements lie. And so we're always looking to chat with people within the community who are in these programs, or even work with populations um, who are in these programs. So we are always looking for stories from individuals. We do have a website, idahosupportsmedicaid.com, and idahofiscal.org. Did I get that right, Cole? Um, if you go to idahosupportsmedicaid.com, you can share your story. We have a survey on there. We also have an amazing story outreach specialist who loves talking to people about their experience. So please take our survey, reach out to us if you would like to chat a little bit more. And we also do offer gift cards for people's time. So please reach out if you would like to share your story. If you are joining because you are a member of the Idaho Center for Fiscal Policy Network and you want to stay more up to date on healthcare issues in the state, please subscribe to Idaho Supports Medicaid. We send out newsletters and opportunities to stay engaged. So you can also subscribe by going to the website, idahosupportsmedicaid.com. And then for those who joined from Idaho Supports Medicaid and want to stay up to date on what's Idaho Center for Fiscal Policy is doing on tax, budget, SNAP, housing, all of those fun things. So please subscribe there or visit idahofiscal.org. And then I know several folks had asked for a recording. If you would like to reach out to us directly, my email is there as well as Cole's. So reach out. We can send you a link to the recording, or if you want a copy of the PowerPoint slides, just give us a quick email. We'll be doing webinars in the coming months as more details come out about the changes to the SNAP and Medicaid program. So please stay tuned. And I'm just looking here to see if we have any other questions. Um, let's see here. So there was a question particularly for about more frequent eligibility checks require more staff at the Department of Health and Welfare. So there was some funding from the HR1, the federal bill that are implementing a lot of these requirements that did provide a little bit of funding to help stand up the requirements. However, I do not believe they're actually going to have more staff at the Department of Health and Welfare to navigate this. And so I think they might be hiring a few more, but not very many. So yes, there's a lot of changes happening and a lot of paperwork coming down the pipeline that people are going to have to submit in processes. So there's going to be the need for more staff. Whether or not they really are going to have them is really another question. And then let's see here. There was a question about certified family home and SNAP, but I'm not really fully understanding your question. So if you can maybe clarify in the chat what you were talking about there. And then let's see here. And then it looks like there was a Q&A. Let's see. There was a question about service coordination. I don't know if I'm really under. Asking about 2030. So Medicaid program is moving to comprehensive managed care by 2030. So it's moving from that fee for service program to comprehensive managed care, which is basically moving Medicaid to basically for-profit insurance companies to manage the Medicaid program. There are some nonprofit ones out there, but a lot of the ones that are mainly out there are really for-profit. Um, And then if you certified family home can ask for SNAP for clients. That is a question. So there was a question about if certified family homes can ask for SNAP for their clients. I believe the best way I maybe can answer that is whoever the guardian is. I don't know if I'm going to be able to answer that one, to be honest with you. I know you can apply for SNAP online, so I can see a process, and maybe Cole, you can correct me if I'm wrong, but you can go online and help folks apply for SNAP online. Um, and however, I am not sure about like going online in person. So I don't know that I'm going to be able to adequately answer that question. Okay. It sounds like if there is a certified family home provider, they can discuss that with their certified family home inspector in their area. So if you have questions about SNAP applications, it looks like if you work with your inspector, they should be able to help navigate that. I will be honest, I am not a certified family home expert. Okay, let's see here. Oh, there was a question about changing the coordinator, the nonprofit agency for service coordination if they move to comprehensive managed care. That is, I think, something that we'll have to see. I don't know how the managed care organizations are going to navigate enrollment and managing. I believe the coordinator, the nonprofit agency, I believe it's Liberty that works with some folks. That helps apply. Managed care handles the processing of claims. So it is not necessarily going to have to do with helping navigating eligibility and as far as I know. However, service coordination under managed care, I am not sure if it'll be under the same agencies or if it will change. It's a little ways down the road. I don't think they figured some of those things out yet. Okay. Again, if you would like a copy of the slides, please email us. I know a lot of folks put like their emails and chat into the chat and Q&A. Please just email us directly. It's hard to capture everybody's emails in the chat, so please just email Cole or I, and we will, after we get it all uploaded to video format, then we can share that out later this week. All right. Thanks, everybody. Appreciate you taking the time to join today. Hope you have a great rest of your day.
Thank you all.